friend of the program, Dr. Pierre Kory, has a new piece out asking, is it long COVID or long vax? With a subsequent question, does the government want to know? And we welcome Dr. Kory back here to the program. It is good to see you again, sir. How are you?
Definitely, Steve. Thanks for having me back.
Let's start there. How did you even manage to get this published over at The Hill?
You know, the tide has to be shifting here towards, transparency, honesty, and truth. I mean, I don't want to overstate that, Steve. I mean, I still feel like I'm living through a dystopian time in terms of censorship, but it's a great question. I mean, something's different. I mean, I have published 3 op-eds, the first one in August on the excess mortality raging through this country. One was in USA Today in August. Now, to your question, Steve, we didn't mention the vaccine when we talked about excess mortality in August. Then we did one in Newsweek where we were able to insert it as maybe something's around the vaccines with other things. But then in December or November, I published in The Hill on excess mortality, and we literally called out the vaccines, and I could not believe that got published. And now here we go again. I got to publish another one, which brings, really hard questions around these vaccines.
So the system wants to acknowledge what folks like you have been pointing out, epidemic rises in autoimmune diseases, what we're seeing with the cancer rates among the young, like people like Ethical Skeptic are pointing out on social media. The system, when it chooses to acknowledge these things, Dr. Kory, wants to say it's because of long COVID. And if we're going to be intellectually honest, we have to say there is at least some claim for this, in that we are dealing with a virus of anywhere from unknown to malicious origin that is clearly not entirely a natural phenomenon, but part of some form of chimeric experimentation. So we really don't know. We don't really know what long-term, even asymptomatic exposure to such a concoction really even is. We don't know that. And so that does give them at least some form of a plausible cover story. So then how do we draw a distinction between, as you're trying to do, I think that can't be your catch-all here. At some point, we got to look at the fact we took the very spiked protein from that chimeric concoction and injected it into hundreds of millions of people, if not billions, all over the world. And we got to finally confront and wrestle with that. Where do you draw that distinction? I mean, you practice medicine yourself with patients. How do you draw it?
Steve, be clearer on your question. I'm sorry. Draw the distinction between what? Between a natural virus and a bioweapon?
Between the fact you can call it long COVID because we don't know really where this virus came from, so we can project anything onto that as the reason why, and not have to actually look at the fact that we took the very spiked protein of that virus and injected it into billions of people, and maybe that's the reason why we're seeing some of these things.
Yeah. So so here's my practice, right? So I have me and my partner, we've treated now and still treating about 1,200 patients. 70% of patients who come to us are long vax. That's the term that we use. It's identical to long COVID. How do I make the distinction? Very simply. Temporal association. What preceded the onset of the syndrome? And like I said in my practice, only 30% are long COVID. The vast majority will report in reliable, repeated patterns when their symptoms onset. I have 3 different patterns. I have one cohort, I'm going to say maybe 15% of my long vax started day of, within minutes to hours of the injection. The vast majority, maybe 70%, it started within days to weeks of the vaccine. And then I have a smaller cohort, maybe 5%, that it'll start quite a few weeks to months. Those are much more rare. Most of them are days to weeks. And long COVID is very similar. They recover from COVID. Most of them, they recover fully, and then the symptoms start to begin. And so it's not that hard to differentiate. I mean, and like I said, the majority is from the vaccine. And the thing that's central to both is the spike protein. One, you get exposed to spike. The other one, you're making spike. And the only big difference, Steve, between the two diseases is severity. On average, my vaccine syndrome patients are far sicker than my long COVID, with a couple of exceptions.
I think the answer you just gave is very important, Dr. Kory, because you're pointing out there is a chain of evidence, to use a phrase here, that we could follow to get to the origin of these maladies that isn't doesn't require some form of, 9-dimensional chess or jiu-jitsu to figure out if it's a question of, do we really truly want to know what the origins of these maladies are in these cases or not, if you're able to track them as you just indicated.
Yeah, and there is a paper that was published maybe 3 or 4 months ago now. It was a huge paper, 250 references, but it literally introduced the term spikeopathy, and it went over all of the pathophysiology that we now know of the spike. There's hundreds of papers showing the effects of spike protein in the body, and immune system effects, autoimmune, immune dysregulation, mitochondria, microclotting, blood. I mean, science actually needs to create a new discipline, which is called spikeopathy. We need to address this. This is causing immense amounts of illness, and as I already mentioned, death. And we have a pathogen that we've let loose that is really sickening people. And if medicine is able to admit this historic and grievous and catastrophic error and actually address this in a responsible scientific way, that's what they would do. But I don't see evidence of that. But I'm pushing. That's why I'm writing these op-eds. I'm trying to get people, and the Hill published it. So it's going to be, we're entering people's minds and making people aware of stuff.
Where are we 3 years after the jab was introduced compared to maybe what you were thinking when it was introduced about 3 years ago to the public?
I can't even, I couldn't even paint the picture of where we are, of how much damage that vaccine has done. It's decimated lives. It has been the large part responsible for the drop in life expectancy in the United States. I mean, we went from 79 to 76 in 3 years. Wow. Who has to die for that? The life insurance industry is reeling from all of these death claims of young people. Our disability rolls are exploding. We have I think we're going to have real problems with the labor force. And by the way, as you and I get older, Steve, I mean, I don't know what the population of young people is going to be at this rate. I mean, I even have crazy thoughts like that. Like, how is this going to affect our society? And we're going to keep walking along like everything's fine. I could never have imagined this scenario 3 years ago, ever.
I think people need to understand when you're talking about a sample or a cohort, when you're dealing with life expectancy, this is a nation of 330 million people. Now that includes children, obviously, okay? But we're talking conservatively hundreds of millions of adults. And in a span of 3 years, you're telling our audience life expectancy has dropped more than 2 full calendar years in the span of 3 years. Because here's what that also means, Dr. Kory. 78, 79, and 80 and 81-year-old people dying because they can't fight off a respiratory virus isn't going to cause the lowering of life expectancy. It's going to be people much younger that we know were without certain comorbidities like an autoimmune or a vitamin D deficiency from obesity, for example, largely recovered something like 99% or higher of the time of a COVID infection. So if you're telling us that we've seen that kind of a drop in life expectancy during this period, it cannot be from COVID-19 and what it did to the elderly, because they already would have been largely at life expectancy. So this would have happened in age groups that were not particularly vulnerable to COVID-19.
I mean, it's like you just did so eloquent. This is simple arithmetic, right? If an average is going to go down that degree, you really have to lose lots of young people. And the most damning evidence is from the group life health insurance data, their quarterly report, and I've written about this extensively. And oh, by the way, the FDA chief even tweeted from the FDA that they recognize this. Now, it was followed by the usual, laundry list of causes, none of this, which included the vaccine because they're safe and effective. But the most damning on the vaccine is the group life health insurance industry report, where when you look at third quarter of 2021, you see an unprecedented, never before seen in that entire industry explosion in death claims in 25 to 34, 35 to 44. It's almost like we sent all our kids off to war, our young men off to war, or women. And nobody's talking about that. And I've worked with the life insurance industry on this issue, and you can tell they don't have an appetite to come out and really call this out publicly. A couple have. There's been some consultants who formed a consortium. They're getting out there. But, all of this kind of work is getting censored. I mean, this is really getting buried. I mean, the colossal nature of the death and disability that has been unleashed, I mean, of course they don't want this to come out. I mean, it'll shred whatever remaining trust, and I don't know where that trust is in our agencies for good.
So while I have you here as someone that is actively treating over 1,200 patients right now in this arena, I want to make sure, because I'm going to get besieged with questions after we say goodbye in a few minutes. Hey, I took this. My job made me do it. I only took it once. What do I do? All right, because we don't know how long that spiked protein stays in your system. We're having a hard time with the censorship, as you mentioned, getting real studies done about this on a consistent level. So what advice would you say to somebody right now if they took one of these dosages of these mRNAs? Would you have the same concerns if you only took the J&J shot, for example? How would you answer those questions?
I don't see that there's a big difference in how dangerous they are. Number one, so it doesn't matter which one you had. My first piece of advice, do not get vaccinated ever again with an mRNA vaccine. Do not let family members get vaccinated. Next, I want to say a note of reassurance. From the epidemiologic data, it's my sense that the farther you are out from your last vaccine, the more likely you're going to be okay in terms of acute problems. That is to say, dropping dead, heart attacks, strokes, all of those things. Those are generally occurring within the first days to weeks, and then there's other blips throughout the year. But after about a year, I think it's going back down to around baseline. So that's the acute stuff. Now, what to do about spike? I would go to my nonprofit website, which is flccc.net. There is one protocol we have on there. It's just suggestions of things that bind spike, that break down spike. Some of these are natural supplements. They're what's called proteolytics or fibrinolytics. And so, we think, again, we have no data. No one's studying this. We don't have the research apparatus or money to study it, but we're just putting out gentle, sound guidance, knowing mechanisms for kind of safe supplements and medicines that you could use if you're really, really concerned. I hope that the vast majority are going to be okay. And like I said, the farther you are out from your last one, I think your prognosis is much, much better.
Is there a critical mass issue that you see in your practice or on the horizon in the data that you think could finally be what blows open the Overton window here? That this is just at this point impossible to ignore, whether we're talking fertility rates, cancer rates amongst the youth, anything of that nature, or something else?
I don't know what that trigger is going to be, Steve. I don't know what that final piece of data. I mean, what I've found is that this is not a data argument. I mean, we've had the data for years calling out this catastrophe, and but that's privately held knowledge. Common knowledge we cannot penetrate. I mean, but I think your opening question, Steve, was great. Like, how'd you get this thing published? Maybe that march. We're going up this hill from private knowledge that everyone needs to be aware of to entering that into common knowledge. I think we are seeing maybe some iterative progress towards that, but I don't know what the thing is that's going to blow. I mean, if the life insurance industry, who makes their money off of actuarial data, who are getting decimated, if that doesn't blow it open, that's an industry. They have no reason to hide this. But the way this society and the institutions are controlled, I mean, so few people have the courage and the ability to really bring it out there in a big way, and probably rightly so, because if they try, they're going to get put down.
Great work, Dr. Kory, as always. Appreciate having you on the show, everything you've done over the last few years, and it's the Lord's work, man. Appreciate you. Thank you.
Thanks, Steve.